What's your thought process on how the FDA has changed over the last, say, 5 to 6 years? Because obviously there's been several different moves by the FDA. There's been a lot of publicity about it. I'd love to get your, kind of basic core thoughts on just the FDA in general.
Usually the news is associated with the biologic division of the FDA. We are under the chemical division, so the chemical division is fine.
It's a completely different
it's a different, we are not in biologics, so it's a different attitude toward development than chemical or drugs.
They have become a little more risk adverse because of a lot of the publicity of drugs that were approved and then there were unknown side effects later on.
Example, Erbitux.
I was going to say that, but Vioxx, so there's a lot of publicity on that. In our case, because the safety is so good, and there are 3 things they look at, 3 or 4: safety, toxicity, tumor shrinkage, and longevity of the patient. Okay. In our case, we've shown improvements in all of those. So you mentioned one, I won't mention the name again, but they got a conditional approval because while they had tumor shrinkage, the toxicity was horrible and the patients didn't actually live any longer, even though the tumor shrunk. Yeah. In our case, we've shown the ability to get rid of the side effects, shrink the tumor, and extend the patient's lives and their quality of life. So when we go to the FDA, when David, and Ellie and Anatole anticipate what they ask, we give them the data, and they love the data, which is why our trials have moved so quickly and they're so small compared to the big drug companies.
Probably a decent percentage of our audience is in the age where they're taking a variety of drugs, and love to have you guys talk a little bit about drug prices. There's been a lot also talking about how certain drugs are just amazingly expensive, and obviously, you look at where you bring in like the pharmacy benefit guys, your drug costs can come down enormously, and you tie the insurance into that. Thoughts on drug pricing?
Interesting. Some of the new ones are very, very expensive to make. So as David said, the biologics, they're horrible. I mean, it costs thousands of dollars to make them. And that's after you've spent the $500 million to get them approved. Yep. In our case, because it's a carbohydrate, it took us about 4 years to figure out how to make. But compared to that, it's an order of magnitude cheaper. So we're talking hundreds, not tens of thousands of dollars for treatment. And the chemo we work with, called 5-FU, which is still the most widely used, it's 40 years old. It's still the most widely used chemo, and it's generic, and it's been generic for a while, so it's relatively cheap. We're talking under $20 or $30 a dose, and a couple of $100s for ours. So if you add it up, maybe $5,000 or $10,000 for the total treatment, whereas with other therapies, you're talking $50,000 to $100,000.
It will be less expensive than the most expensive drug today.
Right.
Right.
It seems capital intense, yet you've done it with very, very little money. At what point do you start to go out and look for a larger pharmaceutical partner? I mean, Glaxo just bought Certus. It seems to me that the way you're going is that a larger company would be more interested even in the research. Not that even it's been approved, but the research has its value.
We find out, to our surprise, actually not to our surprise, that in drug companies there are no carbohydrate chemists. So most of the drug companies ask us to come back with data from in the clinic and manufacturing. Some of them could not believe that such a large polysaccharide can be manufactured as a drug and very precisely. So we are soon to submit the drug master file with the FDA, and having the recent data allow us now to pursue those relations, and we are doing that.
It's every sense of the word, a paradigm shift in the approach, so it's even catching the industry off guard. Correct. Tell me, are there any tax credits that have been available to your company for the research and development of your products?
We never pursue that.
Yeah, we have some tax loss carry forwards, but nothing significant because we haven't spent that much money. So that's nothing we pay a lot of attention to. We need to focus on the trials, getting through that, getting to the approval. And as David said, many companies have told us, once we have that NDA into the FDA, there'll be a lot of people.
Actually, we apply for a grant, government grant called SBIR, and we were rejected because the reviewer thought that our drug will never make it to clinical trial and it looks dangerous.
Oh my gosh. You know, that's very frustrating for somebody who has, you know, colon cancer, or, you know, families with members that have this, because, you know, it's every election year we're promised that there's going to be new investment in new approaches towards, you know, cancer. And it seems almost every election passes by and that doesn't happen.
But that's a human nature. It's very natural. When you come with a new technology, some reviewers are locked in their own view of how development or technology. So it's not something that we should take it as a negative thing. It's just the way human beings look on new technology.
Do you have a website, by the way?
Yes, it's pro-pharmaceuticals with an S.com.
So I'm going to ask for it on the show, because I know a lot of people are going to want to go ahead and follow your progress.
Okay.
You know, maybe not to invest in the company, but just to follow the technology.
Oh, sure.
And you know, I just think it's just remarkable. You know, on my notes it says other uses or other indications. We talked about fibrosis. Is there anything else that people should be aware of that you're working on?
Two more. I don't want to say a lot about them.
Yeah, that's fine.
Again, different
we're running
compounds,
out of time anyhow.
but they're different indications. So we've got cancer, fibrosis, and other things. We've already told people we have an antimicrobial, so it's a synthetic antibiotic, and an antifungal. That is on the back burner because we just don't have the number of people to work on it.
Dr. Zucconi, Dr. Platt, thank you very much for joining us today. I want to thank the viewers for joining us tonight, and don't forget to tune in next week. For more information on this show or any of our other shows, please go to wxcl.org with your questions and comments. I'm James DeGiorgia.
And I'm Jeff Garbaz for The Market Guys. Good night.
To receive a copy of your favorite Wealth and Wisdom episode, or if you have a question or comment about our program, please feel free to write us at Wealth and Wisdom, care of WXCL, P.O. Box 6607, West Palm Beach, Florida 33405. Or call us at 1-800-915-9935, extension 4477. We look forward to hearing from you soon.